The Limpopo Health Department, their MEC, Dr. Phopi Ramathuba, leading a team today to help with community rapid testing for malaria in the Thapane village in the Mopani district of Limpopo. The MEC joins us now. MEC, good afternoon to you. I mean, we've all been focused on COVID-19. Why are you doing this malaria exercise at this moment?
Afternoon, Stephen, and afternoon to all your viewers out there, and thank you for giving us this opportunity. Limpopo province, it's known that especially our Mopani and Vembe districts to be a malaria endemic, and that is why every year during malaria seasons we have to make sure that we conscientize our people and we go all out sorry, to make sure that people are aware of malaria, danger of malaria, and we've seen that working for us. If I'm to take you back, I think during my early days, during the first term, 2016-17 financial year, we registered around 18,500 cases of malaria and 160 deaths. And since that day, we came up with strategy to say how can we really reduce this towards zero malaria. And if you go back, the following year, the cases went down by more than 50% to around 6,000 and only 38 deaths. And up to now, since the malaria season has started, we've registered 200 cases with zero fatality. So the strategy of indoor residual spraying in household, we have seen it working. Now, the COVID-19 has taught us that when you're dealing with infectious disease, the tracing, especially contact tracing, it's very key. So that is why you see us now beefing up our strategies of eradicating malaria from not only indoor residual spraying, but doing house through household testing, using the very same community healthcare workers who have been assisting us with the screening for COVID. Now, what we do, we've got rapid tests now. So when they get into a household, they will screen you and for malaria and even test you, and you will get your results immediately. If you are positive, we have trained community environmental health practitioners who are able to, they've been authorized now by the DG and the Health Professional Council of South Africa to can initiate an oral treatment for malaria. So that it's what you're seeing. The results are we are detecting malaria early, and we are able to prevent malaria. We are able to treat malaria, and therefore we expect to have a zero fatality as a result of this strategy.
One of the things about malaria is that certain forms of it, I mean, cerebral malaria can kill you in 5 days. You get bitten and you'd be dead in 5 days. This shows you how important it is to test people. The problem also with malaria is that it often just presents as a flu. I mean, quite a severe flu, but at first people don't really know what they're dealing with. I mean, this shows you how important a rapid test, a test that is widely available, cheap, and gives quick results can actually be.
You're quite right. Our message has always been we can prevent malaria, and indoor residual spraying has proven to work for us. And also by educating, when you are visiting malaria area, you must take prophylaxis. They do help. When you've got kids at home, advise them not to play outside at night. They must wear long clothes, long sleeve clothes, when they are sleeping at night, and we can avoid being bitten by malaria. But then we know those strategies, they do have some area where people still get bitten and still get infected. Now that's where this particular strategy come in. For those that will not be able to avert being bitten by malaria, it's important to detect it early. During yesterday, when we were at a village in Greater Tzaneen municipality, this is one village where in that year, 2017-18, I think we had 25 deaths in that area. But we have, since that time, strengthened our strategy now. There were people that we tested positive who were, funny enough, asymptomatic. Now, this is the case where a typical example of what you are talking about, that 5 days you get infected, you start with fever, the next thing you are complicating, it's cerebral malaria, and then death. And there are people who are carrying this malaria not even being symptomatic because we're not the same. So this screening and contact tracing of patients who are now confirmed to be malaria positive, we go to their household, we screen the entire family and test everybody in the family. Those who are positive, even if they are asymptomatic, we put them on treatment. We believe it will avert the death that we have seen happening due to complication like cerebral, because you are quite right. Cerebral malaria, we've seen it very difficult to treat. And also, the whole COVID-19 has also complicated issues because everyone who present like flu-like symptoms, everybody concludes that it's COVID. So we also would want to bring back that message to say, in the parts of our province where we are residing, not everything is about COVID. So let's fight malaria with COVID. So also the protocol says anyone who is being tested for COVID must also be tested for malaria. So that is why you see that while we had a COVID-19 pandemic, we have been able to save lives of people who used to die of malaria in the past, because we have picked them up early by using this strategy of getting our community health care workers doing the screening and testing for both conditions.
And MEC, the COVID-19 vaccination program, I mean, obviously that's one of the key processes underway in our society at the moment, perhaps the key process. How's that going in malaria at the moment? Excuse me, how's the COVID-19 vaccination campaign going in Limpopo at the moment? And I say this because we know how important it is, A, but B, there are a lot of concerns that it's just not moving quickly enough around the country.
Yes, it's true that we're not doing well as a country, but of course, as a province, what comforts us mostly is that if you look at the age category that one was quarried a lot, the 60 plus, we long past the 70% mark, and we are still vaccinating those that did not pitch up in the beginning. And I'm still very positive that in terms of the above 50 whom now they are our targets, we've already passed the 60% plus. And then the challenge, it's mainly on the 18 to 49. So this is where we're putting up a lot of energy and a lot of work to be done in terms of vaccine hesitancy. And we can explain this by saying that category, it's on internet, it's on social media. They read a lot of fake stories. They do not necessarily research if this source or a journal or a paper, is it a reliable source that you can rely on the information. So that information, when it's bombarded to them, they tend to believe in. Whereas the elderly generation, they are not necessarily on social media. They believe in their own leadership, in their own community leaders, whether you speak of their church bishops, whether you speak of their king or their queens or their senior traditional leaders. So what we're currently doing now is to focus on those who are educated, those who are younger, to make sure that they also will reach that particular percentage that we want to. And of course, we've already started now with a 12 to 17. We're not very much putting a lot of effort on that age group because, one, they are currently busy with their exams. We don't want them to be defocused. We want them to be focused. It will be good to get the entire family members being vaccinated, but let's allow the kids to focus on their schools. When the schools close, we'll have time, plenty of time to really work with their parents, because as a province, we've said, we're not gonna vaccinate you until your parents and yourself have given both consent after explaining to you. But what is interesting is that after pronouncing that, we've seen more parents coming on board, because once you start to say to them, we will work with you as parents, we will listen to your concern, we're going to explain to you, we're not going to force any of your child to be vaccinated. So we've seen that also working to our advantage. So, but like I've indicated, in terms of vaccination, we are more worried about the 18 to 49 years because those are the people who are really believing in all those vaccines fake news. But we believe we are going to overcome And we with the efforts and all the strategies that we are putting in, for instance, now we've got slogans that while you are campaigning, remember to vaccinate. When you vote, remember to also vaccinate, because it is important. With all our political gatherings, we want to make sure that even if political gatherings tomorrow are to be blamed for driving any wave, we would have averted it if majority of us are vaccinated. So we have seen even political parties, before they could even address, you might have also have seen with the president, before he even addressed any rally, first question is, are you all vaccinated? The second question, are you all wearing a mask? And that leadership which we have seen at that level, we are seeing it in many of the political leaders going around. And we've seen as a province, it's working to such an instance that political parties, when they have got their own rallies, they invite us to say, bring the vaccine. We want our supporters, when they come to the rally, to get vaccinated. So we didn't sit down and mourn and complain to say these rallies might be the source of a misery in future. We sat down and say, let's make this an opportunity to start vaccinating people in the very same rally when they are told by their own leaders that vaccines save lives, not us as a health sector now. They're getting the third party speaking the very same language that you speak about, and it has worked for us, Stephen. So we will continue with the work of vaccination. It's still our primary core and responsibility to defeat the pandemic, because if I'm to be telling you the truth, is that our healthcare services received a knock as a result of the pandemic. We've got backlog, surgical backlog. Last week we were in Bembe trying to clear a lot of surgical backlogs that we could not operate due to the fact that we were fighting the third wave. So we don't want to have a fourth wave, because it's got a real negative impact on the health services.
MEC, I really appreciate the time this afternoon. Thank you. The Limpopo Health MEC, not the Malaria Health MEC, I got that wrong. The Limpopo Health MEC, Dr. Phopi Ramathuba, with you this